If somebody suspects it, what kind of testing can be done to make the diagnosis?
Yeah. One of the things in Alzheimer's disease is that the domain, and we discussed this in our book in detail, that's abnormal in early Alzheimer's is the domain responsible for memory. Because there are other domains. There's another domain just a little further down in the brain that is responsible for verbal fluency, and that means like, oh, what's that thing on the wall with the hands and the numbers on it? Of course,
I
it's
know
a
what
clock.
it is. It's a
Yes, tip of the tongue. So that can be abnormal, and that's the second most common domain involved in Alzheimer's disease. So there are characteristic patterns. You examine a person and you say, this is Alzheimer's disease. Now, we do diagnostic studies, MRI scans, and now there's new scans that are just coming online that actually label the amyloid in the brain itself. You can measure the strength of the amyloid. You can see what the problem is, how it's affecting the brain. That's been a big advance that's occurred just in the last few years.
So amyloid, what is amyloid and what does it do in the brain?
Well, you know, in a way, that's a good question. The amyloid is the major protein involved in Alzheimer's disease. And the interesting thing about it is that it aggregates itself into clumps. It's not in the cell, but it goes up next to the cell and kills off the nerve cells without necessarily going into the cell itself and causing its death.
Now, I hear the word neurofibril tangles.
Yeah, neurofibrillary tangles.
So what is that? Is amyloid
Well,
makes
not
the wires?
amyloid, and this was in the amyloid deposition and neurofibrillary tangles and nerve death were in the original description by Professor Alzheimer's descriptions of the pathology of Alzheimer's. Neurofibrillary tangles occur much more commonly in the front part of the brain, and they're responsible for frontotemporal dementias quite often, which is another type of dementia. But they're small tubules they're inside the nerve, where amyloid is outside the nerve. They kill the nerve off from being inside. And they're little tubules that used to keep the nerve in good shape. I mean, so, you know, without collapsing on itself. And the neurofibrillary tangles results in the nerve cell collapsing on itself. It's inside the nerve and destroys the nerve in that way.